Do you have presenter mode up? Okay, great, thanks. Hi everyone, my name is Aidan Reuter. I'm here to present on behalf of both Dr. John Fulkerson and Alyssa Glennon the Trivara AMZ platform with the mission to provide orthopedic surgeons an elegant solution to restore patellar alignment of the knee joint, and most importantly, to enable patients to return to normal daily activities pain-free. We have a highly experienced team with Dr. Fulkerson founding the International Patellofemoral Study Group and pioneering surgical techniques in orthopedics for over 45 years, and Alyssa Glennon as a champion of personalized medicine and applied engineering here at Yale, following 20 years of med device development experience in industry. Whether it's walking down the stairs during exercise or after an injury, there's a good chance that you've experienced how knee pain or instability can impact your quality of life. Patients with patellar instability are often 15 to 25 years old, present with unpredictable or constant pain and instability, and are often disabled from their desired level of sport or non-sedentary employment. For women, who represent up to 75% of the patient population treated surgically for patellar instability, and young women especially, this disability may lead to depression, social withdrawal, and limit athletic or employment perspectives. Surgically, the function and stability of the knee joint is restored by aligning the patella tracking with the femur using an anterior medial tibial tubercle osteotomy, also known as a TTO. To achieve this correction, the surgeon is working in 3 dimensions to align and unload the joint. Recent research, including our own here at Yale, has shown that we can very precisely calculate the perfect TTO cut for each individual patient, but currently surgeons then perform either a freehand correction osteotomy or use a generic guide that is prone to error, convoluted and imprecise, and the procedure time typically requires around 90 minutes of the total case duration. Surgeons training for this procedure typically require approximately 10 cases at minimum, but according to Dr. Fulkerson, this will take a lifetime to master. The harm associated with inaccurate TTO procedures can be severe, potentially leading to hardware failure, tubercle fracture, or continued patellar instability. Here's our solution. When a surgeon chooses the Trivara AMZ TTO guide, they are employing a device entirely personalized both to the fit on the patient's bony anatomy and to the patient's specific correction calculation. With a precise flat cut at the desired angle we have shown to guide the surgical risk, to reduce the surgical risk and reduce anesthesia and OR time in 16 cases here already at Yale New Haven Hospital, 14 of which were female patients. Dr. Fulkerson stands by the Trivara AMZ guide, and we have received uniformly positive feedback from 5 other surgeons here at Yale. After performing over 1,500 AMZ TTO cases and decades of instructing surgical residents, Dr. Fulkerson is convinced that the Trivara AMZ guide is the best way to translate a lifetime of treating patellofemoral instability into powerful tools for less experienced surgeons. For the patients, this means that successful procedures optimized for their own anatomy to get back to work and play reliably, efficiently, and with less discomfort. For the surgeons, this means less surprises in the OR, less fiddling with unreliable instruments, and in academic institutions, more effective instructions to the next generation of surgeons. For hospitals, the Trivara guide allows completion of the AMZ TTO cases approximately 3 times faster or 1 hour less, allowing for better utilization of OR time, especially for ambulatory surgery centers. Based on CPT code data and a few listed assumptions, we believe that there's a total global market of 60,000 patients or $180 million. Given the prevalence of the Fulkerson AMZ TTO technique and a few additional listed assumptions, we estimate a 75% market penetrance, putting us at 22,500 patients and $67 million. The Trivara platform includes a web app for patient-specific surgical planning and a suite of surgical solutions that we'd happily discuss it further in the Q&A. And the Trivara is patent pending, with 2 major orthopedic companies having expressed interest in licensing this IP. With currently marketed TTO guide systems failing to meet the clinical needs, we plan to enter the market initially with the patient-specific solution we've discussed here. We've also received positive feedback from various subject matter experts pertaining to the proprietary approaches to an off-the-shelf system that interfaces with our established surgical planning techniques. We've also looked at the competitive landscape for this validated commercial market, as there would be potential predicate devices for the 510(k) submission. Using Invisalign's model in orthodontics, we plan to combine the established additive manufacturing technologies and optimize digital medical workflows to power the next generation of personalized knee surgery. Therefore, we are asking the Blavatnik Fund for approximately $30,000 to help us further develop the scalability and further validate the platform, ultimately to negotiate more favorable terms for Yale as we are fielding interest from industry partners. We believe that within 2 years we can achieve FDA clearance for this device and provide surgeons with a more convenient solution for fixing patellofemoral instability. Thank you.
Great questions.
Thank you so much for that. And that GIF just kept going over and over, didn't it, with the kneecap popping out. I know
Gets us every time.
I know you said you'd spoken to some physicians who said that this would, kind of be, it seems kind of game-changing in terms of how they delivered this care. But have you actually spoken to, who would pay for this and what, was it through a hospital system? Have you spoken to anyone about how much they would be willing to pay for this? And if you're thinking about your kind of regulatory strategy, can you share a little bit more about what that would look like? Because it seems like there are codes for this, but do you know what coverage and then payment for it would look like?
Yeah, so the regulatory strategies are pretty clearly defined. The FDA just submitted their final guidance letter for patient-matched orthopedic devices in March, I believe. And so it would be, a 510K. We currently do a lot of these cases at the SRC campus and the McGivney Ambulatory Surgical Center. And probably our highest using customer is Dr. Christine Allen, the chief of the sports med group here at Yale Ortho. She's had a lot of success using it, and it's dramatically increased her efficiency in the OR. So I imagine, any ambulatory center would appreciate being able to squeeze in another case or two, when they're stacking these procedures throughout the day.
Could you talk a little bit more about the automation piece? I know there are some really incredible total knee robots, and I used to be at Medtronic in the robotic surgery group. And I feel like that would be an incredible long-term path. What are your thoughts? Yeah,
so I was actually also on the Missouri team there at Medtronic doing some surgical navigation, but I think ultimately with the exposure of the knee in these cases, I think a 3D printed guide is very convenient for the surgeons to use. You have that tactile feedback. And so we have a couple engineers and, I guess a whole group working under Dr. Fulkerson to really define what the correction parameters look like for each patient depending on their specific knee's coordinate system. And so we've pretty well established that. And, now we've developed a solution to translate that knowledge directly into the OR via this guide. So.
Just quick question, response to the earlier question that hospitals, we think, will be very attracted to this, and that insurance companies will be happy to pay for the guide because there's substantial savings of time in the OR for the patient, probably cut 45 minutes to an hour off the surgical time. So that'll be desirable. That'll cut costs for insurance companies. Thank you.
Thank you.
Wonderful.